Hi, this is Marty Stempniak for H&HN Daily. With November's election on the horizon and the economy still in recovery mode, an air of uncertainty surrounds the healthcare industry and its future. Consulting firm KPMG recently looked to clear up some of that uncertainty by polling a handful of the top executives from health systems, insurers, and pharmaceutical companies. Not long ago, I sat down with KPMG's Ed Giniat to talk about the results and future trends in the healthcare business. So what are some of the more unique partnerships you're seeing forming in the marketplace today?
What we're now interestingly beginning to see are even some more unique kind of strange bedfellows kind of models coming together, and you've seen some of them, publicly announced. DaVita with Healthcare Partners as an example. I think it's Dignity coming together with US HealthWorks. Different examples where there are extended parts of the value chain, if you will, now coming together, or different groups leading, if you will, in terms of who's going to lead in an accountable care-like environment. I think one of the other things we'll begin to see is, you don't need to own all the component parts either, I would suggest. So we're seeing also, and you asked kind of about partnerships. So I think if you think about where, value-based economic models work, what is trying to incent obviously is better quality at lower cost. And one of the ways obviously is around population health management and around wellness and whatnot. So I also think you'll see some interesting partnerships, public-private partnerships around population health, public health, and things like that. So I think we're just at the very beginning of kind of the transformation. So if you think of it, kind of phase one of transformation is about assembling the component parts. And again, you don't have to own all the component parts. And healthcare is still local, and so a lot of them are evolving on a local market basis. But at the end of the day, size and scale are going to matter because you have to take cost out of the system. And then, when you incent quality, more likely than not, the revenue is going to go down. So you have a different sizing where you need to spread the fixed cost over a larger base. So while healthcare is local, I think you'll see larger organizations evolve, much more regional, national, kind of in scale.
Talk about some of the forces in the marketplace that are leading to these partnerships forming. What's causing these? Again,
it's kind of follow the money. I mean, if you think of it that way. So if you think about what some of the early provisions of the Affordable Care Act put in place, it put a lot of pressure on the health insurance segment. Okay, MLR regulations, extending coverage to age 26, a number of other provisions that began to squeeze rate regulation requirements for premium increases at a state level. It started to put some real pressure on the margins and the ability of the health insurance companies to pass on higher premiums to their customers, meaning corporate entities and or individuals and small businesses. And so the ability to cost shift, if you will, in other words, with states in high degrees of difficulty financially, Medicare or Medicaid rates going down, Medicare under pressure, we have sequestration cuts and other things coming. The inability to cost shift that to the commercial side because of these regulations that came in early, basically, in our view, disrupted the equilibrium that existed in the system. So if you think kind of 3 to 5% operating margins, to maintain that, you needed kind of a fine balance within the system. That equilibrium has been disrupted right now. So in many ways, and at the same time, just from a global competitiveness standpoint, in this economy, the continuing increase in cost of healthcare, corporations can't continue to absorb all that. So there's pressure from the top down, there's pressure from the government payers and whatnot, and all that has come together to kind of disrupt what existed in the current system.
Talk about the dangers of moving too slowly or too quickly into a value-based system.
It becomes a matter of timing. You don't want to jump too early. You don't want to be too late to the game. You want to hit the timing just right. So what really needs to happen is First of all, we've kind of been there and done some of this before. It's a very different time and place. You know, it's not the same as it was back in the 90s, because you hear a lot of that, you know, we've been there, this too shall pass. You know, we didn't do it well last time. This time, I think it's too important to fail, first of all. I mean, we have to make the change. We have to migrate to a new model. So what really needs to be recognized, particularly by healthcare providers, is that to be successful under a new model, you need new tools, you need new technologies, and you need new talent. And we need to begin measuring new metrics. We need to develop new metrics to measure under this new model. And healthcare organizations, and it's happening right now in a major way with not only the Pioneer ACO models, the Medicare shared payment models, but the commercial side is experimenting. And this is really important right now. So to be able to build the infrastructure, if you will, to operationalize these new models without going all in too early, because it can have some pretty devastating quick impacts, as we talked about earlier, on revenue, because as quality increases, your revenue is going to go down, less admissions, et cetera. And so the key today is really about planning. Here's what the key stakeholders, where they predict we'll be. Here's where they would like to see us be in 5 years. And then what do we believe is the future desired state? Because if you're not ready, it's survival.
Thanks so much, Ed.
Welcome, Marty.